It was such a treat to meet and greet with CEO Dan Brakeman. But today I have here with me in the studio in our live talk story with House Majority Studio, Representative Mark Nakashima from the Big Island. Mark Nakashima, Chair of the Judiciary Committee, was first elected in 2008. He has served as Chair of Labor, Chair of Economic Development, served 4 years as Vice Speaker, and now currently serves as the Judiciary and Hawaiian Affairs Chair in the House.
Yes.
Chair Nakashima, welcome.
Thank you. Thank you for having me.
Well, so Hilo has undergone some tremendous changes. That segment we just saw took us through things that are happening at Hilo Medical Center, but we were just chatting right before this. We were visiting Hilo. It was one of the last finance site visits we had. Can you tell me a little bit about what some of the plans were at Hilo in 2019?
Yes. In Hilo in 2019, we were looking at expansion of the oncology center, and I think there was a reference to it in your clip. But the oncology center at Hilo Medical Center was very cramped. It was small. People were waiting on top of each other for in the waiting room and things of that sort. And so, one of the things we were looking at is an expansion of the oncology center, as well as being able to do more clinics as part of our Hilo Medical Center's overall plan. And so, those are things that we were able to do recently for the improvement of healthcare on Hawaii Island.
So that's been a real passion of yours over the years. Can you speak to some of the challenges of healthcare on Hawaii Island?
Yes, healthcare has had a number of challenges. There's always not enough specialties available on the island. Getting in to see a doctor may be a challenge. And so one of the things that we have been able to do is provide more services on Hawaii Island for the people on Hawaii Island. One of the biggest things is the catheter clinic to deal with cardiac problems on the island. So a lot of times, if a cardiac patient came into Hilo Hospital, they would be prepped and made ready to travel, but then they have to travel to Honolulu. And by the time you book the air ambulance and actually get them there, precious time is lost. And during that time, your heart is just getting more and more endangered. And so, a lot of times we can get them to Honolulu only to have them die, a few days later. And so by having the catheter center at Hilo, they can fix the problem there and then prepare them for transport in a more timely fashion so that their heart is not dying, waiting for treatment.
Well, I think that whole notion of care on island is so important. So I'm glad that you are such a huge advocate for your community. And I know that Hawaii Island is doing quite a bit with teams and doctors and nurses and physicians and pharmacists. Can you speak to anything about the pharmacy school?
So one of the things that we are fortunate to have is the pharmacy program at UH Hilo. And right now, what we're looking at is care teams to address people's concerns, medical concerns, as well as dietitians and all the kind of the full patient, so to speak, across the board. And so by having the pharmacy school there, by having all these other specialties brought into the picture, you have a much fuller healthcare picture than if it's just the doctor trying to figure everything out.
So I know you have your hands on everything Hilo. So what are some of the other problems that are now emerging? I think we were talking about some transportation issues in your community. What's going on?
Oh, yeah. one of the problems on Hawaii Island is the infrastructure is a good 60, 70 years old. Some of the bridges we have along the Hamakua coast at one time carried trains,
Wow.
and so they've been converted to automobiles, but they're kind of old and aged, and so one of the problems we've had is a couple of the bridges have gone from being full bridges to being limited to 12 tons, and so that precludes a lot of the tractor trailers from using the Hamakua coast as a artery of transportation, and that's really caused some headaches on Hawaii Island. It makes a already tough supply chain even tougher, and it just adds time to the wait between when the shipment leaves and when it actually arrives.
So part of the job then is the work that we're doing with the State Department of Transportation, making sure these bridges are renovated and fixed, making sure that we partner with our federal agencies. Is there anything happening with the State Department of Transportation?
So there is a schedule for repair. However, over the years, I watched that schedule slip as other priorities come up. It it is a statewide system, and so although Hawaii Island has a lot of state highways in it, it's just a small part of it, and definitely not the biggest population center either. And so being able to be sure that that we get our fair share, and maybe a little bit more than fair share because of the great amount of highways highway miles that we have. Just in my district alone, from end to end, it's about 80 miles.
Well, I think this is where our partnership with our congressional delegation is also very important, because there are funds for rural areas, and your area certainly is definitely rural.
Yes,
correct?
definitely.
So there's healthcare, there's transportation. You serve as the chair of the Judiciary Committee, and we've seen in the last few weeks a lot of issues around women's rights,
Yes.
concerns about what the Supreme Court of the United States is doing to women's rights. But we have something that's very a tool in our toolkit, Title IX.
Yes.
What kind of things have we done with implementing Title IX at the state level from your perspective as Judiciary Chair?
So, one of the things earlier this year, I was invited to a blessing of a new locker room for girls softball, and I had not realized it. However, I'm told that before they built this locker room, the girls would have to dress at the PE complex, walk the 100 yards or so to the softball field, past the parking structure and down the park, and then they'd have to go back and in order to shower and change out of their uniforms, and so it's kind of a small thing, but you're just realizing that providing equal access to locker rooms near where you're playing your games is also kind of a critical thing, and a necessary equality that we have to put in place for girls sports as well. So just having the sport is not enough. Providing them the amenities that come along with that is also very important.
Well, I appreciate that insight, because I do think, yes, we need to make sure that the facilities are equal, and we've had this historic opportunity now with funds to be able to invest in facilities to make it a level playing field. Did the legislature also fund more positions to help with implementation and enforcement of Title IX?
Yes, we did put in place this year a number of positions that looked at creating more equality in Title IX. We had a expenditure this year to bring our public schools also up to par in terms of facilities and other needs to ensure equity between their sexes.
Well, again, I'm so appreciative of that, and